Hi everyone, my name is Emily Costabile and I am an MPH student in the Population Health concentration. I completed my internship in the fall 2021 semester with Mercy Clinic in St. Louis. Mercy is a health system that serves multiple states in the Midwest with branches in Missouri, Arkansas, Oklahoma, and Kansas. As part of my internship, I spent a large portion of my time working with Mercy's quality team. This department focuses a lot on population health initiatives, and they have a lot of different projects in the works, from opioid addiction programs to building new healthcare facilities in historically underserved neighborhoods within the community. A lot of my time was spent working with the department's community health worker program. The community health workers in the department work closely with social workers and leadership to put patients in touch with resources to help address any identified needs a patient may have. As part of my time with this program, I got to participate in a lot of different projects. In the beginning, I spent some time working with department leadership to develop the orientation curriculum for newly hired community health workers. One of the items I created for the orientation can be seen on the right-hand side of my poster under the miscellaneous section. I developed a new organizational chart to help the community health workers and the social workers understand the structure of their program, as well as the overall structure of the department. And then below that, you can also see two informational pieces that Mercy uses to help educate on what social determinants of health are. I then had the opportunity to help work on a rebranding project for the Community Health Worker Program to help better differentiate it from other programs within the health system. And then the majority of my time was spent on developing my final work products, which were educational materials to be used internally with clinicians and externally with patients to help educate on social determinants of health. And these two flyers that I developed can be seen in the middle of the poster, along with their respective QR codes. So early on in my internship, the leadership I was working with had identified that education surrounding social determinants of health was a really great need for both patients and providers within the health system. Mercy and its community health workers have a tool to screen patients for needs based on the social determinants of health, and it was found that a lot of patients were resistant to that screening because they didn't understand what it was. They didn't understand why it was necessary, and they didn't understand how the social determinants affect their overall health. And many patients were voicing that they didn't think that they needed the assistance and that there were other people who needed the help more than they did. And then on the clinician side, many clinics were not compliant with distributing the social determinant screeners that the health system had created, and it was believed that the barriers to distribution came from the providers and clinics not understanding why screening for determinants is a part of caring for a person's overall health. So my final work products were aimed at providing education to both patients and clinicians on what the social determinants of health are, why it's important to screen for these determinants, and how they can have an impact on a patient's current and future health outcomes. So I developed two separate flyers to communicate this messaging, one that was built at a reading level of a clinician, and then one that was built at a lay patient reading level. I collaborated with team social workers, community health workers, and leadership to develop these materials so that they would best fit the current identified needs, and so that the social determinants that were appearing on the screener that patients receive in clinic would be consistent with what was being explained on the flyers. And then as part of developing these work products, I found it was really important to demonstrate cultural competence, especially as I worked to build the flyer for the patients. Knowing that there are a lot of patients in the community who historically have not been receptive to the work of the community health workers played a large role in helping me shape the language of the flyer, even down to the graphics that I chose and the coloring that I chose and the layout that I chose. And then the plan for these materials is to have them taken to marketing within Mercy with the intention of then distributing both of the flyers as rack cards in new clinician orientations with newly hired community health workers and with patients when they arrive at their appointments and receive the social determinants screener simultaneously. So the goal is that these flyers will help to improve patient and clinician understanding of the impacts social determinants of health have on a person's current and future health. From this, the hope is that this increased knowledge of the social determinants of health will increase patients' receptiveness to receiving the assistance of community health workers with any identified needs in the hope that better health outcomes can be achieved long-term and that patients can be reached further upstream. So I got to see the importance firsthand of educating both patients and clinicians on the impact social determinants of health have on a person's health outcomes. I also got the chance to see why it's really important to have a care team that's all on the same page in delivering a public health program. And there were a lot of challenges that came up when leadership had different visions for the program or the execution of the work of the community health workers was not consistent across the board. So with that, I had the opportunity to see how the way leadership handles conflict resolution is vital to the success of a program and how important it is to establish a team that supports a unified vision for the work that's being done. So overall, this internship gave me the opportunity to see the difference public health initiatives can make in the lives of the people being served. And it gave me a really realistic view of how difficult it can be to get these programs off the ground, as well as what it takes to make them sustainable long term. And that is all I have. Thank you so much for your time today.